You have looked at your hands today. You looked at them this morning while you made your coffee. You looked at them an hour ago while you scrolled through your phone or folded laundry or held a cup of tea. Most of us glance at our own hands somewhere between 2,000 and 3,000 times a day. And in almost every one of those glances, we see nothing. We see hands. We see fingers. We do not see what is actually there. Here is what I mean. Your car has a dashboard. When something goes wrong under the hood, a small light turns on, long before the engine actually fails. That light is not the problem. It is a messenger. It is the vehicle trying to warn you early, while there is still time to do something about it. Your body has a dashboard too, and one of its most honest, most consistently ignored warning panels is sitting at the end of your own fingers. In our last conversation, I told you that your fingernails can reveal warning signs involving your kidneys, your blood, and even your nervous system, years before other symptoms ever appear. Today, I am keeping that promise. I am going to walk you through 4 nail signs worth checking tonight, in your own bathroom mirror, in under 2 minutes. Stay with me until the end, because the final sign, the one most people miss entirely, is also the most common one there is. I am Dr. David Thompson. I have spent more than 15 years in clinical practice, and in that time I have learned something that surprised me early on and has never stopped being true. The body rarely fails silently. It almost always tries to tell us first. The real problem is not that our bodies fail to warn us. It is that most of us were never taught how to read the warning. That is what this channel has always been about. Not fear, not panic, just translation. Taking what your body is already saying, in a language you were never taught, and turning it into something you can actually use to protect your independence and your vitality for years to come. Before we go further, I want you to do something for me. Down in the comments, tell me your age and tell me whether you have noticed any changes in your own nails recently. Ridges, color changes, anything at all. I read every comment, and by the end of this video, you are going to want to go check. And one more thing, because it matters every single time I say it. Nothing in this video replaces an actual physical exam from your own physician. What I am giving you today are reasons to ask better questions, not a diagnosis. A nail sign is a clue. Your doctor is the one who solves the case. Keep that in mind as we walk through this together. Let's begin with sign number 4. Look closely at your nail plate, not the skin around it, but the hard nail itself. Are there any thin, reddish-brown lines running vertically underneath the surface? They look almost exactly like the name suggests, as though a tiny wood splinter had slid just beneath the nail and left a streak behind. These are called splinter hemorrhages, and the mechanism behind them is worth understanding. Underneath your nail bed runs a delicate network of tiny, longitudinal blood vessels, capillaries so small and so densely packed that even a minor disruption can cause a small leak of blood. When one of these vessels breaks, the blood does not pool into a round bruise the way it might elsewhere on the body. Because the nail bed's ridges run in straight lines from base to tip, the leaking blood is forced to travel along that groove, which is exactly why the hemorrhage comes out looking like a thin, straight splinter instead of a blotch. I want to be careful here, because nuance genuinely matters with this particular sign. The vast majority of splinter hemorrhages are completely benign. Minor trauma, closing a car door a little too hard on a finger, an aggressive afternoon of gardening, even a bump you do not remember, can cause 1 or 2 of these to appear, and they typically fade on their own within a few weeks. But here is where it becomes something worth paying closer attention to. When splinter hemorrhages appear on multiple fingers at the same time, without any history of injury, and especially when they cluster closer to the middle of the nail rather than near the tip, that pattern has long been associated in clinical literature with conditions affecting the small blood vessels and the inner lining of the heart, most notably infective endocarditis, an infection of the heart valves. It has also been observed in some autoimmune vasculitis conditions, where the immune system mistakenly attacks the walls of its own blood vessels. Let me tell you about a patient I will call Robert. Robert was 68 years old, a retired mechanic, the kind of man who had spent his whole life working with his hands and never thought twice about a nick or a bruise. He came into my office for an unrelated checkup, and almost as an afterthought, he mentioned that he had noticed several thin red lines under his nails over the past 2 weeks. He had assumed he had simply bumped his hand somewhere and forgotten about it. But when I looked closely, I saw the same pattern on 4 different fingers, on both hands, with no history of trauma to explain it. Combined with a low-grade fever he had been dismissing as a lingering cold, that finding led us to order blood cultures, which ultimately identified a valve infection that, left untreated, could have caused permanent heart damage. Robert's case is a perfect example of why one splinter hemorrhage is like a single car alarm going off on your street. Probably nothing. Someone bumped it. But 5 or 6 alarms going off at once, with no storm and no obvious cause, is a pattern worth investigating. If you notice multiple splinter hemorrhages appearing at the same time, especially alongside unexplained fevers or fatigue, here is exactly what I would want you to say at your next appointment. Tell your doctor, "I have noticed several splinter hemorrhages on my nails without any injury. Could we listen to my heart and consider checking inflammatory markers or blood cultures?" That single sentence gives your physician exactly the thread they need to start pulling. Now let's move to sign number 3. This one requires you to look at your nail from the side, almost like checking the horizon line on a piece of wood. You are looking for a horizontal groove or indentation, a line that runs across the nail from one side to the other, rather than up and down. These are called Beau's lines, and the story they tell is remarkable because they function almost like a tree ring for your body. Your nail is manufactured continuously by a structure just beneath your cuticle called the nail matrix. Think of the nail matrix as a small, dedicated factory that never stops producing, laying down new nail cells day after day, which then get pushed forward and hardened as they travel toward the fingertip. Under normal, healthy conditions, that factory runs at a steady, even pace, which is why a healthy nail is smooth from base to tip. But when your body goes through a significant systemic event, a severe infection, a major surgery, an episode of extremely high fever, uncontrolled diabetes, or even an intense period of physical or emotional stress, your body does something remarkable. It temporarily diverts resources away from what it considers non-essential functions, like nail production, and redirects everything toward survival and repair. The factory does not shut down completely, but it slows dramatically or briefly halts. Once the crisis passes and the body stabilizes, the factory resumes its normal pace. That pause, that brief interruption in an otherwise continuous manufacturing line, is what leaves a permanent groove behind. Because fingernails grow at a fairly predictable average rate of roughly 3 millimeters per month, physicians can actually measure the distance from that groove to the cuticle and estimate with reasonable accuracy when that stressful event took place. A groove close to the cuticle points to something recent. A groove near the tip may point to something that happened several months ago. This is genuinely one of the more elegant clues in clinical medicine, a timestamp your own body writes for you, whether you asked for it or not. I think of a patient I will call Dorothy, 72 years old, who came to see me 6 months after a serious bout of pneumonia that had landed her in the hospital. She had recovered well and felt fine, but she noticed a distinct groove running across several of her nails and wanted to know what it meant. When we measured the distance from her cuticle, the timing lined up almost exactly with her hospitalization. In her case, the line was simply the record of an illness she had already recovered from, and that reassurance meant a great deal to her. But that is precisely why this sign is worth knowing. If you find a groove and cannot connect it to any illness you remember, that absence of an explanation is itself the reason to bring it up, because Beau's lines have also been associated with peripheral vascular disease and with conditions affecting circulation to the extremities. Tell your doctor this. I found a horizontal groove across my nail, and I cannot recall being sick. Could this be related to a blood sugar or circulation issue we should check? Before we move to sign number 2, I want to ask you for something. If this video is helping you, please hit the like button right now. It genuinely helps this channel reach more people who need to hear it. And if you are checking your own hands as you listen to this, type the word vitality in the comments below. I want to see how many of you are looking at your hands in real time. Sign number 2 involves a simple test you can do right now with your own 2 hands. Take your 2 index fingers and touch the nails together, back to back, so the nail beds are facing one another. Look at the space where the nails meet. In a normal, healthy hand, you should see a small diamond-shaped gap of light right where the 2 nails meet. That little window is called the Schamroth sign, and its presence is reassuring. But in some people, that diamond-shaped window disappears entirely. The nails meet flush against each other with no gap at all, and the nail itself curves downward like the round top of a spoon turned upside down, while the fingertip beneath it appears swollen, almost bulbous. This is called nail clubbing, and it is one of the oldest documented physical signs in medicine, with descriptions dating back more than 2,000 years, which is why clubbing is sometimes still referred to in older textbooks as Hippocratic fingers. The mechanism is genuinely fascinating. Clubbing is believed to be driven largely by chronically low oxygen levels in the blood, or by certain growth factors and platelet-related substances that, under normal circumstances, get filtered out efficiently by healthy lung tissue. But when the lungs are compromised by chronic obstructive pulmonary disease, lung cancer, pulmonary fibrosis, or certain heart conditions that allow blood to bypass the lungs' filtering process, those substances escape into general circulation instead of being broken down. They travel out to the fingertips, where they promote extra tissue growth and fluid accumulation just beneath the nail. Over months or years, that extra growth physically reshapes the fingertip and the nail sitting on top of it. Think of your lungs as the filter in a fish tank. When the filter works properly, waste products get broken down before they can affect the rest of the tank. When the filter begins failing, those waste products start circulating everywhere, and eventually you see the effects far from the filter itself, at the very edges of the tank. Your fingertips are the edges of your tank. I recall a patient I will call Frank, 64 years old, a lifelong smoker who came in for what he thought was a routine cough that would not go away. During the exam, I asked him to do the Schamroth test, and the window between his nails was gone. His fingertips had a subtle bulbous quality that he had genuinely never noticed, because it had developed slowly over what was likely a year or more. That finding, combined with his cough and his smoking history, led us to imaging that identified a lung condition at a stage where treatment could still make a real difference. Frank later told me that he had looked at his own hands every single day for a year and never once seen what had been changing right in front of him. That is precisely why clubbing is so easy to miss. Nobody notices a change that happens gradually over 18 months the way they would notice a sudden rash. An old photograph of your hands is genuinely more useful here than today's mirror. If you have the chance, pull up a photo from 2 or 3 years ago and compare it to today. Tell your doctor this. I did the Schamroth window test on my nails, and I am not seeing the normal gap. Should we check my oxygen saturation and consider imaging of my lungs? Now we arrive at sign number 1. I want to be honest about why I saved this one for last. It is not because it is the most dangerous of the 4. It is because it is, by far, the most common, and the one that gets dismissed the most often, usually as simply getting older. Look at your nails again, but this time look at the overall color of the nail bed itself, not just for lines or streaks. In a healthy nail, you typically see a pale pink color throughout most of the nail, with a small white crescent near the base. With this sign, that appearance changes. The majority of the nail bed turns an opaque ground glass white, almost like frosted glass, and that white coloring extends nearly to the very tip of the finger, where it is replaced by a narrow band of pink, or sometimes reddish brown, only in the last 1 to 2 millimeters. This is called Terry's nails, first described by Dr. Richard Terry in 1954. The mechanism behind it makes sense once you understand what you are actually looking at. Underneath your translucent nail plate sits a bed of tissue rich in tiny blood vessels, which is what gives a healthy nail its pink color. You are essentially seeing blood flow through the tissue underneath. In Terry's nails, changes in the connective tissue beneath the nail bed, along with a reduction in the small vessels visible through it, cause that tissue to thicken slightly and become less transparent. Instead of seeing the pink of blood flow clearly through the nail, you see a hazier, whiter version of it, similar to how a frosted glass shower door lets light through but blocks a clear image behind it. Here is why this matters so much. Terry's nails have consistently been associated in clinical literature with liver conditions, particularly cirrhosis, where studies have found this nail change present in a substantial majority of patients with advanced liver disease. It has also been documented in chronic kidney disease, particularly where kidney filtration function is reduced, as well as in congestive heart failure and adult-onset diabetes. I think often of a patient I will call Margaret, 75 years old, sharp as anyone I have ever met, who came in for an entirely unrelated visit. I noticed her nails were almost entirely white, with only the faintest band of color at the very tip. When I asked her about it, she told me she had simply assumed her nails had changed color the way hair changes color, a normal part of getting older, and she had never mentioned it to anyone, including her own children. A simple blood panel revealed reduced kidney function that she had no other symptoms of whatsoever. Because we caught it there, at that quiet, unannounced stage, we were able to adjust her medications and her diet in ways that protected her kidney function for years afterward, rather than discovering the problem only once it had become loud and undeniable. That is why I call this the most overlooked sign of the four. It develops so gradually, and it can look so close to what we simply assume is normal aging nail color, that most people, and honestly sometimes even their own family members, never think to question it. It does not hurt. It does not itch. It does not announce itself. It simply sits there quietly, month after month, while the organ behind it may be under real, ongoing strain. Think of it this way. If your kidneys and liver are the water treatment plant for your entire body, filtering out what should not be there, then Terry's nails are like a slight discoloration showing up in your tap water. It is not an emergency by itself, but it is exactly the kind of subtle sign that tells you it is time to check the plant, not just wipe down the faucet. If you notice this white, ground glass appearance with only a thin band of color at the tip, tell your doctor this. I have noticed my nails look mostly white with color only at the very tip. Could we run a basic liver panel and kidney function test just to check? That is a simple blood draw, and it remains one of the easiest, lowest cost ways to catch a slow-moving problem years before it becomes a loud one. Let's bring this all together. Splinter hemorrhages, thin red streaks that, in clusters, may point toward the heart and blood vessels. Beau's lines, a horizontal groove that acts like a timestamp for a major bodily stress event. Nail clubbing, a slow reshaping of the fingertip tied to oxygen and lung health. And Terry's nails, that quiet whitish shift so often written off as simply getting older, when it may actually be your liver or your kidneys asking for attention. None of these four signs, on their own, are a diagnosis. I want to say that clearly one more time. A nail sign is a clue, not a verdict. But here is what I know after 15 years of practice. The patients who do best, the ones who catch serious conditions early enough to genuinely change the outcome, are almost never the ones with access to the fanciest technology. They are the ones who paid attention to the small, quiet signals their own bodies were already giving them, and who were not afraid to bring those observations to their doctor and ask a specific, informed question. That is what today gave you. 4 specific, informed questions. Go check your hands tonight, not out of fear, but out of respect for the fact that your body has been trying to talk to you the whole time, in a language you now understand a little better. If today's video gave you something worth holding on to, type the word independence in the comments, because that is exactly what early detection protects: your independence, your time, and your ability to keep living life on your own terms. If this video helped you, please share it with someone in your life who could use it: a parent, a sibling, a friend who is always dismissing their own symptoms. Early detection does not just save time. In many of these cases, it genuinely saves lives. Now, before you go, here is what is coming next. There is a set of ordinary morning habits, things almost all of us do within the first 30 minutes of waking up, that can silently spike blood pressure to dangerous levels long before you have even had your coffee. Most people have never been told this, and once you see the research behind it, you may never approach your mornings the same way again. I'm Dr. David Thompson. I'll see you in the next video.